Morning, everybody. Let's see, let's start that again. Hello, everybody. This is Anthony, and I am here from Heal, Lead, Teach, Breathe, Center, Balance. Let me tell you, I'm still dealing with this thing. Oh, look at my cast matches my shirt. Isn't that amazing? Well, I'm color coordinated. What can I say? um, so what I want to talk about is, I don't know if anybody has had a cast out there that has gone through this surgery. And believe me, if you've gone through this surgery, you know what I'm talking about. Forget about it. Forget about it. Anyway, so surviving a cast, you know, the thing that happens here when you have a cast on that I forgot about, that nobody really tells you, is that it can take weeks to heal things and months. And you may be stuck with this cast on for a while. So remember, it is not easy to sleep with this. I have had many nights where it's unbearable as far as sleeping. And your partner will be the one that suffers, not only you. You will both suffer because you're together, unless you put ice on it and take your ibuprofen and your Motrin and your whatever else you're taking. So it's very important because the ligaments, tendons, and other tissues can take many, many weeks to heal. Okay. So the fact is that I am still able to move these fingers and I am not really having pain here. This is not the problem. The problem is the thumb. And that's what, is feeling numb and weird in there. So I just want people to understand that this process is not easy. I am able to type a little bit with it, but it is tiring and it's painful and it's hard to maneuver with this thing on. Soon I will be getting this other thing that I found that they told me to buy. So I bought one that's sort of like it, not really the same. They told me to buy a spica cast of some type here. And so there's tons of them on Amazon. I ordered one and so anyway, I get this off in 1 week. 1 week, this mother comes off. And I can't wait to get it off. Now, you can still feel pain in the cast. You can feel swelling. It's normal to have all of these feelings. And so just remember that just because you have the cast on, nothing is going to be easier. It's a little bit more difficult. It's hard to take a shower. It's hard to clean up. But in the end, what we're going for is better movement, less pain. So you've got to have some pain in order to get across to the other side, to where what it is that you want, that your desired effect. The desired effect is less pain, and more movement if possible. So we want optimal. And I mean, in our day and age, the way we live today, everybody wants to optimize. Well, and it is important to optimize what you're doing on your videos, what you're doing on your emails, at work. Everybody wants more with less. Same thing, only this is your body speaking to you. It does not, this is one thing that we all have to learn. So anyway, one of the things I want to do and end with today here, if I can find my little hammer, is my little, to ring the bell, and that I'm in gratitude today for healing, that I have 1 week left of this. And then the day after, I start physical therapy. But anyway, I'm grateful to be alive. And I just want to say blessings out to the people in Maui. You know, that is a horrible thing that has happened there. But I know good will come out of this. We don't see all of it right now. And eventually there will be better things happening. But it's a sad thing that all of these people had to die and go through that tragedy and trauma. That's a horrible trauma to go through. Jumping out of your car and jumping into the ocean because you're running from flames. It is not a fun thing to do. So I send blessings to the people of Maui and Lahaina, and I've been there a couple of times. It was gorgeous. I loved it. I'm glad I got to see it when I did. And now I know that it is destroyed and it will never be the same way it was. But maybe something else can be done to make it better for the people that live there. So if something does happen again, it won't be as tragic. So that's all that we can hope for. And I'm very grateful to be here in Las Vegas, where it's, I don't know, maybe about 90 or 100 today. It's workable weather. It's getting cooler. I can't wait to get this off so I can go in the water and exercise again and do some stuff. So anyway, um, and it does take time. You just got to be patient. I'm not a patient person. Like I'm a nurse. I was a nurse. Do you think I'd be patient? Nurses are the worst people to deal with. They're the worst people. So, bye. I'm going to say bye for all.